Hi, everyone. Welcome to the Medcurity podcast. My name is Melinda Navala, and I'm your host for today. Today, we have a really special guest joining us, Dan Fox. He's the managing director of healthcare at Drips with over 12 years of experience in conversational AI technologies. He plays a pivotal role in helping health insurers and providers integrate proactive AI into their communication strategies. His leadership has driven innovation in the sector, transforming how organizations engage with their members. Prior to Drips, Dan led product marketing and strategy at Smart Action, a leader in AI-driven customer service solutions. Dan, welcome to the show.
Thank you so much for having me.
Yeah, I'm so glad you decided to join us. To start, could you tell me a bit about your journey into the world of AI and what drew you to the healthcare sector?
Yeah, it was interesting. I started, with a connection back in 2011 to a speech recognition company. And this is like the early days of speech recognition before, now we call customer service has gotten a lot better. But I think when we remember what the systems were years ago, it's like agent, agent, agent. Not saying it's all
Yes.
better now, but at the time we were really pioneers in this human assisted way to create large language models. And we
Mhm.
created these really robust speech recognition systems. So it was fun being really early on in the customer service sector for speech. Through that, I really learned about conversational AI over all channels. And when I learned more about, what Drips was doing in the healthcare space, it's really what drew me in is the ability to actually make an impact. Solving someone's customer service issue, yeah, that makes you feel good about your day. But helping somebody get a vaccine that they wouldn't have gotten otherwise, helping someone
Mhm.
schedule an annual wellness visit for someone who hasn't been to a PCP in the last year or two. These are things that you can really go to sleep, well at night, knowing that you've been able to make significant impacts on member outcomes or patient
Mhm.
outcomes.
Yeah, it's awesome. It's really interesting to see that how the chat has improved, and I feel like at times like you can't even tell if it's a human or not.
Yeah,
It's pretty awesome.
it's
Um,
amazing. There's been so much innovation in that space, and now with some of the large language models with ChatGPT, it's just like
mhm.
unbelievable opportunity. Now we just need to rein it in and figure out how to leverage that in a controlled environment where you have
Mhm.
things like HIPAA information in healthcare.
Mhm. Yeah, yeah, it's interesting to see how healthcare is shifting with AI, and I'm curious, like what outside of your work, like what kind of AI tools do you like to, use at work and your personal life? Like, and I've noticed that some people are more hesitant and other people are just love it and use it for everything. And I'm just curious, what do you use it for?
I am a like I use ChatGPT so much. It's really just an amazing tool. I don't use content generated from ChatGPT. I
Mhm.
like to put my own
Mhm.
voice on things. Like I pride myself as a good writer, but in
Yeah,
terms of editing the content that I write, helping
yeah,
build business cases. Like when we're building business cases at Drips, like right now we're working on a program with a payer in utilization management and really saying like, hey, can you check my work here? What are the aspects of
yeah,
this business case that I haven't looked at?
yeah,
Translating things, into different
yeah.
languages. Like I built a model the other day to estimate, the cost of living differential between,
Uh-huh.
what you'd make if we lived in three different cities based on the tax rate and the cost of living. So it's my right hand person and I use it,
Yeah.
maybe a dozen times a day.
Yeah, yeah, it's great. It's interesting, like when you talk to people in public and in general, I think some people have this fear that, oh, AI is going to take over the world, and we're going to lose so many jobs. And I mean, for me personally, I view it as a tool and I use it in similar to what you're describing. If I have a little bit of writer's block, I'll put into the AI what I've written, and I'm like, hey, what do you think? And it will just give me ideas. And then I
Mhm.
don't actually use the text. It's just kind of finding what am I missing or what do you think I can add? I think that's pretty incredible. So what
Yeah.
do you tell what do you tell people who are, more hesitant users or especially in like the healthcare context?
Uh, so I think there is a lot of danger with, or not danger, but a lot of risks with
Mhm.
AI in healthcare. Like you have to look at, what the industry is ready for and what the technology is capable of. And that's really like at Drips as a managed service, I think we come in between. There's some amazing technologies that Amazon puts out, but it's not healthcare ready. The
Mhm.
challenge is you have, a lot of bias built into models, and with a big
Mhm.
focus on health equity with CMS,
Mhm.
like there are some, major concerns that, when you have bias built into healthcare models, it's not a model that works well for everyone. When
Yeah.
I was in the speech recognition space, even outside of healthcare, you look at speech recognition models, and most speech recognition models do not understand people of color as much as they
Yeah.
understand white people, because the speech recognition models were mostly trained on white people in the early days. So
Yeah.
if you magnify that out to what we're doing in healthcare, yeah, there's a lot of risk to using AI. On
Yeah.
top of that, if you're ever getting close to giving medical advice or saying
Mhm.
like you should go to the doctor or you shouldn't go to the doctor, there are some major risks associated with that. But
Mhm.
ultimately, it's inevitable, right? And
Yeah.
I think the best use case of this is the self-driving car, which, like, as a
Mhm.
huge fan of all futurist technologies, I remember
Yeah.
reading maybe 10 years ago that self-driving
Mm.
cars, we would not be able to create a self-driving car, that it
Yeah.
was it was light years away, that the technology wasn't there, that there was too much
Yeah.
risk from putting these cars on the road. And yes, there's risk, but there's risk for putting humans behind the wheel as
Yeah.
well. And
Yeah.
I live in Austin, Texas, and now we
Mhm.
just rolled out autonomous Ubers around the city.
Oh wow.
There's Waymos driving all over the city without people driving. And it's funny, the things that we said weren't possible 10 years ago are
Yeah.
here. So I think it's the same thing for healthcare. It's like, this isn't
Yeah.
a something that we say, no, we're not going to do this. It's no, we
Mhm.
need, an AI strategy. We need to figure
Mhm.
out how we're using these tools, how we keep these tools updated, how we adapt
Mhm.
them to our organization. Because the only winners that will come out in the next
Yeah.
few years are the ones that are really deeply leveraging AI.
Yeah, yeah. And just kind of identifying, those problem spots and setting up, the guardrails and things like that. And I mean, it must have been such a wild feeling to when you first see one of those self-driving cars. I have yet to see one, but that's pretty interesting to think about. It's funny that you
Yeah.
mentioned the bias and the tools. Just yesterday at the office, I was chatting with my coworkers. We were testing and playing with different AI tools, and one of them was like a voice recognition, and I think it was going to imitate speech or something. I can't remember exactly which one it was. And we were talking about languages and accents and things like that. And I mentioned, I was like, I wonder how it reacts if somebody has like a mix of different accents. For instance, my aunt is from Finland, and she married an Italian guy. And so he moved to
Mhm.
Finland and he speaks Finnish with an Italian accent. So I'm thinking, how is that going to, if he's speaking into the AI tools, like how will that handle that,
Totally. And now, and now we're
that language?
talking in the healthcare arena, we're talking about people, who may be sick, who may have disabilities that prevent them from engaging the same
Mhm.
way. And an AI tool in the healthcare arena needs to work for everyone, not just the people who can, find a way to
Yeah,
use that tool or are capable of using that tool.
yeah, yeah. So tell me about drips and how your helping health insurers and providers improve their communication.
Yeah, so at Drips, we focus on proactive communication. I think it's kind of
Mhm.
like the last frontier for innovation in the healthcare arena.
Mhm.
If you look at all of the ways that we've innovated in inbound customer service, like all the things we're talking about, like amazing chatbots, everything else like that. How do we
Mhm.
reach out to patients? How do we reach out to members? It's the
Mhm.
same stuff we've been doing for decades. Outbound
Mhm.
calls, blast
Yeah,
text messages, letters in the
yeah,
mail. Like, there's just been no, we're like, oh, we're going to A/B test, this message to see if we get a better response from our direct mail piece. And it's just not at the
yeah.
pace that we all engage. We view
Mhm.
healthcare communications the way that people reach out to members, patients. They're treating it like
Mhm.
marketing, and they're not treating it like a conversation. So what we
Mhm.
do is we reach out over text. We believe,
Mhm.
SMS is kind of this major unused channel, or used
Mhm.
in the wrong way, where it's really used as like a
Mhm.
billboard rather than a place to start a conversation. Because at the end of the
Mhm.
day, all of us use SMS. It's not
Hmm.
segmented to one type of person or one type of population. It's a universal
Yeah.
technology, but brands are not using it. Like many payers and providers are sending like very basic text messages. What we do
Yeah.
is we start a conversation. It would say something like, "Hey Mel, we wanted to reach out about scheduling your annual PCP visit. When's a good time to talk?" And when we
Yeah.
ask a question, we can get some really good back and forth engagement. And what we're able
Hmm.
to do is drive more folks to an outcome for that brand.
I love that. And if you think about it, whenever, like, especially when everyone gets phone calls from unknown numbers, you don't have every number saved in your phone. I could say personally, unless I'm expecting a phone call and I kind of have an idea of where it's coming, I don't answer them. I wait until I get a voicemail and then I call back because you get so many bot calls and things like that, and or it's like, oh, just text me or text me before you call so I know that it's you or something like that. When you're calls from outside of your contact list. But also
Mhm.
kind of speaking of like the those appointments and like that communication where it's very like human friendly and engaging. Like I think of, for instance, like I don't like to go to the doctor or the dentist. Like I try and put it off as much as possible. And of course, if I get a
Yeah.
text message from the doctor saying, "Hey, just so you know, it's been a little while," kind of thing, it's like,
Mhm.
okay, yeah, I guess I'll go in, and it just kind of puts that in your mind, like, oh, yeah, I've been ignoring this for about a year. I should probably make an appointment. Um,
Exactly. I
yeah.
love the dentist personally. I know I'm like pretty alone in that, but I cannot wait to get to the dentist. But I don't think I went like even me working in healthcare, I don't think I've
Yeah.
had an annual physical in a year, which is so bad because I just forget, right?
Yeah.
And
Yeah,
the
exactly.
thing is like those robotic, like schedule your appointment, blah, 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 like you make it super personalized to somebody
Yeah.
and chances are they respond to it and it's just a nudge
Yeah.
because at the end of the day that phone tag that you're describing, that only works if you have the intent to call them back, if you care about
Hmm.
it.
Hmm.
For a lot of people, they're just not engaged in their
Hmm.
health in the same way because it's not the biggest priority. Putting food on the
Hmm.
table is the biggest priority. Getting the kids to school is the biggest priority.
Hmm.
So trying to say, hey, you should get that mammogram. It's just like,
Hmm.
no, I can do that tomorrow, especially if it winds up being a game of phone tag. I'm just not going to
Yeah.
remember to call back.
Yeah, and if you think of like what kind of appointment it is, it's like, oh, we got to do your blood draw. Oh, I don't really want to, you know. Of
Totally.
course, it's like, okay, yeah, okay, fine, I'll do it. And I think that, like you said, like the SMS, it's really underutilized. Because while I do get emails from the doctor's office, like kind of those routine ones, ignore them or they go in the spam box or they're mixed in with everything else that's in my inbox. So it's
Mhm.
I think text really is like the best, or like the SMS, like the best way to communicate. So when you're thinking of like healthcare organizations and like the AI communication and different tools that they're implementing, especially over the past few years and kind of going forward, like what kinds of things that or challenges you notice or hear about, I guess, when you're talking with prospective clients and your current clients?
Yeah, it's interesting. Like you have the AI industry, which is moving light years, like so fast. I follow like Sam Altman and all of these other,
Mhm.
futurists, and the technologies that we're rolling out are faster moving than organizations can keep up. And that represents a major disparity because if the organizations are constantly playing catch up to what
Mhm.
AI is available out there,
Mhm.
it's not sustainable. I think all
Mhm.
organizations have to look at what is their AI strategy and how can
Mhm.
they actually leverage these tools effectively and to overcome the biggest barriers because AI
Mhm.
is not AI is a solution, but you
Mhm.
need to identify what your problems are and what you're trying to solve. If member engagement is a challenge, maybe look at AI for that. If prior
Mhm.
authorizations are a challenge, look at AI for that. If
Mhm.
you're in the hospital system and you're looking at robotic,
Mhm.
surgeons, like look at AI for that. But you have to identify your problems and what are the ways that you can possibly fix it, and then figure out what your AI roadmap is beyond that. All organizations also need to be creating AI, councils where they're figuring out
Mm-hmm.
what their strategy is. And we've seen a lot of healthcare organizations start to roll these out. The challenge, to your point, is that, what exactly is AI and what is, just a label for something that we've been doing already? Because AI has been in the ether for
Yeah.
decades. Like
Yeah.
it's a
Exactly.
different input and like large language models, and
Mm-hmm.
it's an amazing time because we have so much attention and we have so many
Mm-hmm.
eyes on AI right
Mm-hmm.
now. But a lot of what we've been doing, like Drips has been in business for 10 years. We've been doing
Mm-hmm.
AI conversations. It's
Yeah.
just getting a lot of attention right now, and you have to figure out,
Yeah.
like, am I creating a blanket solution to figure out AI compliance for my organization, or do I need
Yeah.
to look at the nuance behind what are we labeling AI and what do we need a strategy around? Because robotic
Yeah.
surgeons have a much different, AI requirement, and a lot
Mm-hmm.
more risk than AI
Mm-hmm.
related, conversational outreach like what we do.
Yeah. Yeah, it's been interesting to kind of see how also just like legislation's been changing a bit with like the different like privacy and I've seen like headlines about AI, and I feel like it really is getting a lot more attention, but like you said, it's been around for a long time, and I think there's so many things that people are interacting with that are involving AI, and they don't realize it, and it's kind of like one of those, oh, it's just a buzzword. It's like, okay, AI is here to stay, and so how do you incorporate that? And Medcurity, we work with, security risk analysis and HIPAA compliance, and kind of help healthcare organizations assess their risk. And one of the things that we, have to incorporate, or I think thinking forward, is the AI tools, and, implementing different, I guess, teams and guidelines, and thinking about like security and all of that. And like you said, it's here to stay. And I think all healthcare organizations and every company in general, if they're not using it right now, they're behind, you know.
100%.
Um, so thinking about like as far as like the sensitive nature of the healthcare interactions, like how does Drips, or how do you implement like the AI communications that's like has a personality and is empathetic, or like, thinking of the topics that might make people hesitant, I guess, to talk about.
Yeah, I mean, specific to proactive communication, it's all around like guardrails, guardrails,
Mhm.
guardrails. So we
Mhm.
built a system called our Drips rules engine that basically takes into account every law, regulation, restriction
Mhm.
around reaching out to people across all industries. Because we also work outside healthcare as well. So that's TCPA regulations, AI regulations, FCC regulations, HIPAA regulations, and building
Yeah.
that into the system has allowed us to feel more comfortable doing that outreach, knowing that we're not going to text somebody at a
Mhm.
time when you're not allowed to text them. We go
Yeah.
down
Oh,
to,
that's awesome.
yeah, I mean, something that's really cool. We do state and local emergencies. So if there's a flood, if there's, a fire, we actually
Mhm.
have a way to segment those populations that may be impacted based on their zip code or their area code, and we suppress all messages to them just as a way to be more
Okay.
conscious about the outreach that we're doing.
Oh,
On top
wow.
of, yeah, it's cool.
That's incredible.
So something else that we do is we make sure to never solicit, never ask people to reply to us in a way that could risk them giving us PHI over text.
Mhm.
So if, for
Okay.
example, we said something like, "How are you feeling today?" We don't want to know. Like, don't send us that over text message.
Yeah.
So all of our conversations are either driving somebody to a secure place where they can tell us behind
Uh-huh.
a HIPAA authentication, or we drive that conversation in a very segmented way. So we say, "Hey, Mel, we see that you're overdue for a preventative care appointment. When is a good
Yeah.
time to talk?" So that person is replying to
Oh,
that
okay.
question, when is a good time to talk, which is going to
Yeah.
limit the amount of PHI that comes back. And if
Mhm.
PHI does come back, we have a way to scrub that out of our systems. And we say, like, "Hey, just so you know, this is an unsecure channel. So don't give us PHI," or whatever we say, but
Mhm.
in that same vein.
Like it gives you a prompt essentially, like if they do post something in there or send something through. Oh, that's cool.
Yeah.
Yeah. I thought it was like there's an article I read recently that was mentioning that you have like a almost like a automatic or automated consent manager. So like if people are depending on their level of engagement with the communication tool, like if it will either say, okay, they don't seem interested in using this, and you kind of naturally opt them out. Am I interpreting that right?
Yeah, you nailed it. I mean, this is a big topic of conversation right now. There's a current court case that's happening where somebody texted a system and said, duck off, and that
Mhm.
wasn't acknowledged by the system,
Mhm.
and it wound up in a lot of trouble, or the system
Mhm.
wound up in a lot of trouble. So what we're able to do is naturally understand all the ways that somebody could opt out of a program, which isn't
Yeah.
just like stop and cancel. It's, hey, I already got my physical, I don't need this, or hey, I
Yeah.
already picked up this medication. And when
Yeah.
when you open up that system to AI, what you allow
Mhm.
the member or the patient to provide their barriers to why they're not
Mhm.
doing something. And
Mhm.
once you understand their barriers, you have a lot more information about them. Because right
Mhm.
now, if you do the spray and pray, you don't know.
Mhm.
Like, you're texting people who may have changed numbers. You have the wrong
Yeah.
person. You're texting people who maybe changed medications. You're texting
Yeah.
people who, are not interested in this. So rather than
Yeah.
having them reply stop, if they can say, nope, I
Yeah.
don't need this, then it's a much,
Yeah.
you don't have to permanently take those folks out of a program. You can just say, all right, we're not going to text them about annual wellness visits
Yeah.
because they said they already had one done.
Yeah, no, I love that because like one of the things, or I guess as I've been reading, pending privacy legislation, or some different court cases and things, because privacy is one of the things like I'm just kind of personally obsessed with, and I think
Yeah,
of like, okay, consent management, and like how do you kind of work that into everything that you do, and one of the concerns that I've kind of seen, one of the common threads is when people they're given a bunch of forms and things and they click yes, yes, yeah, because they're in a rush, or maybe they're not feeling well, and then they're opting into things, and they're like later it's not something maybe they really wanted, or maybe it is something they wanted, but just like that
that's like
adaptive ability to say, okay, well, maybe they didn't actually want this. Like that's really awesome.
totally. And that nuance has to be there because not all texting is created the same. Like, what we're doing,
Mhm.
helping people, schedule, appointments, is
Mhm.
governed under the same
Mhm.
laws that when I swipe my credit card at some
Mhm.
acai place when I'm on vacation, and
Mhm.
it's with Square, and now I start getting text messages from this acai place I'm never going to go to
That's so
again just
true.
because I swiped my credit card. It's not
Yeah.
fair, but
Yeah.
unfortunately it's the environment that we live in.
Yeah.
And the best thing that you can do is like have a way to for people to say, no, I'm not interested in that,
Mhm.
and
Yeah.
remove themselves from what they
Yeah.
don't want, but give them the option. The same way you
Yeah.
do an email. When you click unsubscribe, you're like, yeah, I don't
Yeah.
want marketing emails, but I definitely want appointment reminders.
Yeah. Well, and if you think of it in the context of like data as well, and you look at your analytics and you're like, okay, what is my patient base, or who wants to come here? And then if you have that information of the people who opt out or who are not engaging, then you kind of have a better sense or more accurate, I guess, picture of like who your people are, as far as
That's
your
right.
organization. Yeah, and I think it also is like kind of like a protective mechanism, because when I've like looked at cases with the FTC or FCC or OCR, like the different entities that are regulating all these different things, if one of the cases or some of them are actually, okay, well, you said people consented and then you change this, but like if you have that built in, I imagine that's protective for the company when it's like opting people out automatically, and then it's because yeah, I, I don't know what your
100%.
thoughts are on that, but so
Yeah, it's consent is a conversation that we're having every day. And it's something where you want to do the right thing for the member, and you also want to do the right thing for the plan, because you want to, like, you need to retain, sorry, your ability to retain a member and engage a member is dependent on you having access to them. And access cannot just be direct mail. by having their
Yeah.
address, and it can't be
Mhm.
from outbound calling. So keeping
Yeah.
SMS consent, that is the
Yeah.
key to making sure
Yeah.
that member gets something done.
Yeah, yeah. And if it's an organization that you're familiar with and that rather than like the SIE place that you went to one time, like you
Yeah.
actually don't mind those text messages. I personally don't. Like I never thought it never even occurred to me really when I'm getting these text messages from the doctor's office or something like, oh, that's bothering me. It's like I actually like it. So
Totally.
I
Yeah.
appreciate it. I prefer it over the voicemail.
Same. Then I have to like listen for 5 seconds before I can delete it and the
Exactly.
notification goes away.
Exactly. So as far as like operations and integrating, different AI tools and modernizing, like how do you think of like communication, how this tool will save organizations money and just streamline their
Yeah.
operations?
Yeah, that's the key. I think for us, we look at where proactivity is going to make the biggest impact because
Mhm.
there are, like, if you look at a health plan, you want to communicate with members when they're signing up for the plan, when, the annual enrollment period to make sure that they stick with the
Mhm.
plan. You have pharmacy wanting to reach out, you have formulary changes within the pharmacy.
Mhm.
You have all of the HEDIS measures for stars and you just want to make sure that you're thoughtful about the touch points that you use and making sure that you leverage
Mhm.
those touch points effectively. So within that, you want to prioritize where you're going to make the biggest impact. And that's probably being
Mhm.
pretty targeted and segmented for who you communicate with and making sure that you
Mhm.
use the right message to the right person and making
Mhm.
sure that that program is going to drive the biggest impact. Something that we recommend out of the gate for a lot of plans, like look at that ECP appointment because that is the gateway
Mhm.
to getting somebody healthier. Telehealth,
Mhm.
fantastic. In-home assessments, fantastic.
Mhm.
Nothing has been proven to close more care gaps than getting a
Mhm.
person to visit their doctor in person. That's the way it
Mhm.
is, right? And
Yeah.
for a lot of the government programs, when you do sign up for them, you're either auto assigned a PCP or you select a PCP, and helping that
Mhm.
person find a PCP who's accepting members for that plan and
Mhm.
getting them to visit them, that's going to have
Mhm.
so much bang for your buck. On top of
Yeah.
that, triple weighted medication adherence measures, making sure that all of the things that impact medication adherence, which are maybe transportation barriers, enrolling that person in
Mhm.
mail order pharmacy, overcoming the barriers to why they haven't picked up those medications, anything along those lines, you're going to have
Mhm.
such a dramatic impact to the business.
Mhm. Yeah, I can definitely imagine that. And so like as far as like when you're talking to your healthcare providers or payers and just kind of about the communications and AI and things like that, what are the like like any sort of like hesitations or questions that people have or just kind of I guess misconceptions that people might have about like, the AI tools and embedding that into healthcare operations?
Yeah, I think there's a lot of, fear around large language models and
Mhm.
hallucinations that you may say back to a customer or a member or a
Mhm.
patient. And, missing any of those things that are important. Like what happens if
Mhm.
somebody texts you back and they say, hey, this person had a stroke? You need
Mhm.
a system that's robust enough to handle that. And
Mhm.
so that's a little bit of the concern there is if you're building any types of these tools
Mhm.
in-house with
Mhm.
technologies rather than doing this as a managed service, you have to make
Mhm.
sure that you're building in a robust way where you can capture that. And that's very tough
Mhm.
because healthcare organizations shouldn't have to become experts in text messaging. They should be
Mhm.
experts in
Yeah.
delivering healthcare. So our
Yeah.
recommendation is always like partner, build what you're good at, and then partner with
Yeah.
what you need coverage on. We think text
Yeah.
messaging on the surface, very easy. Once you dig into it,
Mhm.
very
Mhm.
difficult. So our recommendation is like figure out your strategy for that proactive communication,
Mhm.
prioritize the use cases that are going to have the most bang for their buck, and
Mhm.
then determine and measure their efficacy to make sure that, the risk that you're exposing to your organization by implementing AI will have
Mhm.
its reward.
Mhm. Yeah, so like as far as like how things are evolving and what Drips is doing and kind of what you've seen just in the marketplace, like what are the like changes or like the areas where you think are really going to impact I guess the healthcare experience as a whole for both the patients and the providers and payers, I guess everyone involved. Like
Yeah.
what are you kind of seeing on the horizon?
Yeah, I think AI is like a really interesting way to plug like fix things that won't be fixed organically. Like I'll give you an example of a company that I spoke to recently that's like very early company in this space,
Mhm.
but a big problem with scheduling PCP appointments, like, the payers want to help you schedule a PCP appointment, but you're talking about like millions of different EHRs, that they're
Mhm.
using. And just because you've integrated with Epic doesn't mean that you've integrated with all
Mhm.
Epics. There's, so many different
Yeah.
implementations. So we talked to this company who's actually using voice bots to call providers and ensure like, hey, are you taking this plan? Are you taking members? What's your
Mhm.
availability? And help like autonomously schedule an appointment with the front desk person. And it's just genius because you don't
Yeah.
need to integrate with that system. You're dealing with a person, but you've used conversational voice AI to
Mhm.
overcome that barrier of those disparate data systems, because I haven't seen anything that would fix that problem, because everyone
Mhm.
would need to say, I'm going to integrate with that solution. Like, we're just
Yeah.
not there. The level of effort isn't there. So I think if we can see AI in some of those use cases, it's really interesting. Specific to what we do in proactive AI,
Yeah.
we're focused on being hyper segmented on the populations that we're working with, and making sure
Mhm.
that we're not engaging all people the same way, and using
Mhm.
whatever data that we know about a member to help drive the
Mhm.
right conversation. A great example of that is tech fluency, digital
Mhm.
fluency. If you're dealing with somebody who's, on a chronic conditions plan and they're over
Mhm.
80 years old, trying to get them to enroll in a digital program on their phone, probably not going to
Mhm.
happen.
Yeah.
So how can you treat that member a little bit differently? Maybe you want to get them on the phone with a
Mhm.
person to help explain them the program, or, message their caregiver in a different way. So
Mhm.
there's a lot more of a lift that you can get from the outcomes when you're speaking
Mhm.
to a person in the right way.
Yeah, and that's kind of like when you speak of like the proactive AI, it's like adapting to the individuals and I think that just kind of improves the whole experience or just like people's likelihood of actually engaging and not having, I guess, opting out. It's like if it actually is tailored or personalized and they feel like they're talking to a human. I'm sure I feel
Yep.
like a lot of people like especially when the Chat GPT and the Google Geminis and all that came out, everyone was just, I remember specifically a day at the office when everyone's like, oh, it launched, like, and everyone's playing with it and testing different prompts and seeing what kind of responses they could get.
Yeah.
And it's just getting better and better. It's pretty awesome to see.
It's fun,
Uh,
and getting better at prompting these systems, and,
yeah.
and using them, and yeah, I find it all pretty fun.
So thinking more about the future, like if you're able to talk about it, what does Drip have planned for the year? And like, do you have any like company news or announcements or things like in mind?
Yeah, we our big focus this year is on expanding languages. We have, traditionally, supported English across all of our programs. We just realized that
Mhm.
there's so many members that we're not able to get in touch with because we're only communicating in English. So it's a huge priority
Mhm.
for us, and we're standing that up as we speak. The ability to communicate in additional languages. So
Mhm.
that's probably our biggest focus. We're also focused on what we're calling close the conversation, which is creating
Mhm.
digital capabilities that help people complete an outcome without ever having to get on the phone. So something that we built over the last year was like a beautiful health risk assessment. So the ability to do surveying in a really nice interface. Like, you look at a lot of the HRA products out there and they're like ugly and have tiny
Yeah.
radio buttons, and it's just not the UX that really modern marketing companies have
Yeah.
taken. So now we're taking that same marketing philosophy, because that's we were born in the marketing space, performance marketing
Yeah.
space. So we're applying that
Mhm.
logic to how we're building digital tools. And yeah, so we're focused right now on, hey, if we can mobilize that member over SMS, what can we have them
Mhm.
do? How can we have them
Mhm.
complete an outcome without having to ever talk to a person?
Yeah, I love that. It's so interesting, like how, with all these AI tools, it's like, oh, I don't want to talk to, but it is like there's certain things you don't feel like having to pick up the phone, or maybe you're not in an area or position to like actually talk and call someone. Maybe it's like there's other people around, or you don't have opportunities where there's a whole lot of privacy around you, or quiet. And yeah, no, that's really neat to hear. And of course, like the language and like the like inclusive and tools and things like that, just kind of understanding the differences in people. I think that's really neat to hear. When I'm thinking of like all these tools and like everything that we're implementing, cybersecurity comes into mind, or just, and so kind of like, can you tell me about like how, you've built that into Drips, or how, I guess, companies that do use these tools can kind of maintain that, or things to kind of think about when they're implementing these things?
Yeah, I mean, it's the process, like it's a pain for us as a vendor to go through all these compliance audits, but like in my
Hmm.
opinion, it just shows that a company is taking this stuff seriously, because reaching out to members and patients is serious stuff. Like you do not want to mess
Hmm.
that up. Like
Hmm.
you need to make sure that you're partnering with a company that is going to have the right safeguards in place. So when you're looking at opt-out strategies, consent strategies, like we were talking about, when you're looking at PCI, PHI protections, you need to make
Hmm.
sure that's built in, making sure
Hmm.
that you're following all of the regulations and laws regarding
Hmm.
proactive outreach. It is mission critical not to get
Yeah.
this wrong. So our recommendation is to make sure that you are going through the proper compliance audits
Hmm.
on any of these technologies that you're bringing
Hmm.
in, because just because you see that a company has done work with another company in your space does not
Hmm.
mean that all of the protections taken for your company
Hmm.
are going to be taken with the same seriousness. And
Hmm.
can't say it enough. Like I think um, all of the AI councils that are coming up,
Hmm.
yeah, like we were talking about earlier, we're not exactly sure. Like we're trying to solve a problem, for something that
Hmm.
is ever changing, and it's difficult
Yeah.
to, say, hey, this AI is, safe for us, versus like, hey, this AI is unsafe for us. But
Hmm.
our recommendation is continue to invest in
Yeah.
those authority boards to make sure that
Yeah.
what you're bringing on board is safe.
Yeah. Neat to hear that that's in there. And, it's something to kind of think about as far as like any of the healthcare technology tools, kind of how to build that in, like the security, what do they say, like privacy first or security first, or those kinds of things. I've enjoyed talking with you. I guess before we wrap up, is there anything else that you want to add or talk about, or bring to anyone's attention as far as communication, or just kind of thinking about the future of healthcare?
No, I'd say, if there's one thing I could leave the audience with, it's there's there are much better ways to reach out to people than what we're using today.
Mhm.
And if you invest in those tactics to improve your proactive experience while making sure that you're keeping up with all of the compliance that's required, there's going to be a
Mhm.
major unlock for your brand in terms of
Mhm.
driving outcomes, overcoming barriers, and getting people healthier.
That's great. So, thanks so much for joining. Thanks to everyone for tuning in. Also, all of the information for getting into contact with Dan and learning about drips, will be in the show notes. Yeah, thanks again for joining. And this is another episode of the Medcurity podcast. Tune in again next time, and we'll be in touch. Thank you.
Thanks, Mel.